Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below in order to help support our community here at DamiRx Care. Also, you'll be able to get alerts anytime we post our other educating videos and content here on our YouTube channel. All right, so what is our topic of choice today? Our topic or medication of choice today is Losartan. So Losartan is a medication that's used in treating patients who have hypertension, heart failure, gout, or patients who have kidney disease, whether it be in a diabetes setting or a non-diabetes setting. This medication can be used in treatment of the kidney disease in order to kind of slow down the progression of kidney or renal disease. So what is the dose that this medication is usually taken in? So patients usually take this medication as a 25 milligram to about 100 milligram dose once a day. So the maximum dose is 100 milligram tablet once a day. And it comes in a 25 milligram, a 50 milligram, as well as a 100 milligram tablet. So what is some side effect of this medication to look out for when taking the medication? So it can cause dizziness. So you want to make sure you're avoiding anything that requires you to be mentally alert while taking this medication, or, you want to try it for a couple of weeks before you start, doing those activity that requires mental alertness while you're on the medication. That way you're fully understood, the effect of the medication or how well your body tolerates it. Also, this medication can cause back pain. It can cause cough, as well as upper respiratory infection. So usually in a setting where it causes cough, it's usually more of a dry cough. And some patients will notice that it goes away after a period of taking it, while some patients don't continue to have it as long as they've been on that medication. So usually patients, if it gets bothersome and this is, a preferred medication that you would like to stay on, some patients might take a medication called Dizziness, which can just help, reduce that dry cough that they're having. Also, like I said, patients may notice nasal congestion or your upper respiratory tract infection while taking this medication. So these are just something to look out for while you're on the medication. So what are some serious side effects that you want to look out for or reach out to your doctor immediately for when you start seeing them while taking this medication? So some serious side effect would be lightheadedness, dizziness, or, consistent dizziness or lightheadedness or fainting. If you have any rapid weight gain while taking the medication, if you start noticing a swelling, an abnormal swelling in your hands or your ankles or your feet, or you notice changes in how much or how often you urinate, if you start noticing some confusion, weakness, and uneven heartbeat, or trouble breathing while you're on this medication, or numbness or tingling in your hands, feet, or your lips, then you want to make sure that you're reaching out to your provider immediately when you start noticing the symptoms. So what are other things to look out for while you're on this medication? So this medication is a no-no in our pregnant patients. So this medication may harm the fetus. So immediately you notice that you're pregnant, make sure that you're reaching out to your doctor and stopping the medication immediately, because this medication is not preferred in our pregnant patients. Also, this medication can increase potassium in the body. So it is not advised for patients to, take other potassium supplements or substitute while on this medication in order to avoid an increased value or an increased amount of potassium in our body, because this can also affect the heart. Also, this medication should, like I said, can cause dizziness. So it should be avoided in patients who haven't taken it for a long period of time enough to know what the side effects are in terms of like their mental alertness while taking this medication. So you want to, like I said, avoid any activity that requires you to be mentally alert when you first start this medication. Also, you want to make sure that you're drinking plenty of fluids while you're on this medication, especially if you start noticing that you're sweating more than often, or if you're exercising, Or if you have any diarrhea or vomiting, then you want to make sure that you're drinking plenty of fluids in order to avoid dehydration. And also with this medication, the drug dose may change, or the doctor might alter your dose here and there until they're able to get a great amount of the tablet that's able to help control your blood pressure. So the doses may change in between treatments, so that's just something to look out for, just in case the doctor increases your dose. You want to make sure that you're staying on top of it and taking the right dose when it comes to this medication. Also, you don't want to double dose this medication in order to avoid increased side effects such as lightheadedness, the dizziness that we talked about. Also, this medication can lower your blood pressure too much, especially when you first start using it. So you want to make sure that when you're getting up and you've been sitting down for a longer period of time, making sure that you're getting up slowly. That way you don't feel, too dizzy to the point where you kind of faint, or, have that faint feeling when you get up all of a sudden after sitting down for a longer period of time. Also, this is not a medication that you want to be taken with a set of medication called NSAIDs. And an example of NSAIDs would be your ibuprofen, your medications such as naproxen. Those are medications that are not even preferred in our patients with high blood pressure anyway. So you want to make sure that you're avoiding these medications while you are taking Losartan, in order to, help avoid any effect on your kidneys while you're on this medication. So I hope you were able to enjoy this video and learn one or two things about this medication and how to effectively use it. We hope to see more of you in our other videos, so make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and contents, and also be able to support us here at our community at DMRX Care.